हेलो स्टूडेंट्स, आज हम रिकॉल करेंगे एनाटॉमी एम्स 2019 मई प्लस नवंबर के PYQs। फर्स्ट क्वेश्चन है, विच ऑफ द फॉलोइंग मसल्स इज नॉट सप्लाइड बाय द मार्क्ड नर्व? दिस वन। ए सुपीरियर रेक्टस, बी सुपीरियर ऑब्लिक, सी मीडियल रेक्टस, डी लेवेटर पाल्पेब्री सुपीरियोरिस। इसका आंसर है बी, सुपीरियर ऑब्लिक। The nerve marked is oculomotor nerve. The superior oblique is innervated by the trochlear nerve, cranial number 4. Question number 2. Find out the wrong statement about levator any muscle function and support. A. Supports pelvic viscera. B. Converges downwards and medially. C. Its parts are iliococcygeus and pubococcygeus. D. Attached to pelvic brim. इसका आंसर है D. Attached to pelvic brim. Attached to pelvic brim, levator ani muscle is not attached to the pelvic brim. It takes its origin from the body of pubis, the arcus tendinous of the levator ani, a thickened part of the obturator fascia, and the ischial spine. Levator ani muscles innervated by the anterior ramus of S4 and branches of the pudendal nerve roots S2, S3 and S4. The levator ani is a broad sheet of muscles. It is composed of three separate paired muscles, pubococcygeus, puborectalis and iliococcygeus. Question number 3. Correct sequence of structure in spermatogenesis event: spermatozoa, spermatogonia, spermatocyte, spermatid. Select the correct answer using the code below. इसका आंसर है बी। सबसे पहले आएगा second, third, fourth and 1. Spermatogenesis is the process by which haploid spermatozoa develop from germ cell in the seminiferous tubules of the testis. This process starts with the mitotic division of the stem cell located close to the basement membrane of the tubules. The spermatogonium undergoes mitotic division to form two primary spermatocyte, largest germ cell. The primary spermatocyte undergo first meiotic division, reduction division to form two secondary spermatocyte. The secondary spermatocytes thus have a haploid number of chromosomes. Each secondary spermatocyte immediately undergoes second mitotic division, that is mitotic division. Meiotic division, that is mitotic division, to form two spermatids, each with haploid number of chromosomes. Each spermatid gradually changes its stage to become a spermatozoa or sperm. This transformation of circular spermatid into an elongated spermatozoa is called spermiogenesis. Thus, from one primary spermatocyte, four spermatozoa are formed. Two with 22 autosomes and one X chromosome, 22 plus X, 22 plus X, and two with 22 autosomes and one Y chromosome. Question number 4. All of the following are branches of external carotid artery supplying the nasal septum except A. Anterior ethmoidal artery, B. Sphenopalatine artery, C. Greater palatine artery, D. Superior labial artery. इसका आंसर है A. Anterior ethmoidal artery. Anterior ethmoidal artery blood supply of nasal septum. The anterior and posterior ethmoidal arteries arise from the ophthalmic artery in the medial third of the orbit. Ophthalmic artery is a branch of internal carotid artery. Superior labial artery is a branch of the facial artery. Facial artery is a branch of the external carotid artery. Sphenopalatine artery and greater palatine artery is a branch of maxillary artery. Question number 5. In the following image, the person started surface marking of thorax from third costal cartilage to sixth costal cartilage, and a marking point was given. The marked point identifies A. Thoracic duct, B. Right atrium, C. Infromedial bronchopulmonary segments, D. Hilum. Answer is B. Right atrium. The region marked corresponds to the surface marking for the right atrium. The costal margin, xiphoid process, and the mid-clavicular line are seen in this image. The examiner draws a laterally convex line that extends from a level below the second costal cartilage as clued by the sternal angle, that is third costal cartilage, to about 3 spaces below, that is the third sixth costal cartilage. This lies about 1.2 cm lateral to the sternal edge. These suggest that the region marked corresponds to the surface marking for the right atrium. Question number 6. Structure that divides liver anatomically based on Coinout's classification system. A. Portal veins. B. Hepatic artery. C. Bile duct. D. Cystic duct. इसका आंसर है A. Portal vein. The structure that divides the liver in Coinout's classification system is the portal vein. The Coinout's classification of liver anatomy divides the liver into 8 functionally independent segments. Each segment has its own vascular inflow, outflow, and biliary drainage. In the center of each segment, there is a branch of the portal vein, hepatic artery, and bile duct. Question number 7. Which of the following finger is having two dorsal interossi muscle? A. Index finger. B. Little finger. C. Middle finger. D. Ring finger. Answer is C. Middle finger. The middle finger has two dorsal interossi. The four dorsal interossi muscles are bipinnate in nature. First two attach to radial side of proximal phalanx of index and middle finger and blend with the dorsal digital expansion. The third and fourth to ulnar side of the proximal phalanx of middle and ring finger and blend with dorsal digital expansion. Second and third are attached to the radial and ulnar sides of the middle finger. Dorsal interossi causes abduction of fingers from the middle third finger. Question number 8. Blood supply of the marked structure in the given specimen is derived from which of the following arteries? A. Middle cerebral artery. B. Internal carotid artery. C. Anterior cerebral artery. D. Vertebral artery. इसका आंसर है C. Anterior cerebral artery. The structure marked in the image is the fornix. It is supplied by the anterior cerebral artery. The anterior medial central branches from the anterior cerebral artery supply the fornix along with optic chiasma, lamina terminalis, hypothalamus, para-olfactory areas, and cingulate gyrus. Question number 9. Which of the following nerve supplies the marked structure in the given below image? A. Cranial number 2. B. Cranial number 4. C. Cranial number 3. D. Cranial nerve number 6. इसका आंसर है B. Cranial nerve number 4. The structure marked in the image is the superior oblique muscle. It is innervated by the trochlear nerve. All the muscles of the eyeball are supplied by oculomotor nerve except superior oblique, supplied by trochlear nerve, and lateral rectus, supplied by abducens nerve. Question number 10. Which part of the brachial plexus does not give branches? A. Roots. B. Trunk. C. Cords. D. Division. इसका आंसर है D. Division. The division is the brachial plexus do not give any branches. The roots, trunk, and the cords all give out direct branches. Question number 11. Lesion of the marked structure lead to A. Loss of sensation of tip of index finger dorsal side. B. Loss of sensation over hypothenar muscles. C. Loss of sensation of the tip of the radial bone. D. Loss of sensation from fourth interdigital cleft. Answer है A. Loss of sensation of tip of index finger dorsal side. The structure marked in the image is the median nerve in the cubital fossa. A lesion of the median nerve causes loss of sensation of the nail of the index finger as it supplies lateral 2/3 of palm by superficial cutaneous branch and lateral 3/2 fingers. Palmar aspect and dorsal aspect of nail beds by palmar digital nerve. The median nerve continues in the cubital fossa medial to the brachial artery and passes between the two heads of the pronator teres deep to the bicipital aponeurosis of biceps and superficial the brachialis muscle. It crosses the ulnar artery while being separated by the deep head of the pronator teres. Median nerve cutaneous innervation. It then travels between the flexor digitorum superficialis and flexor digitorum profundus. The median nerve is accompanied by the median artery during this course. Then, about 5 cm above the flexor retinaculum, it emerges between the flexor digitorum superficialis and the flexor carpi radialis into the hand. Question number 12. Identify the marked layer in the given histological section. A. Inner plexiform layer. B. Outer plexiform layer. C. Inner limiting layer. D. Outer limiting layer. इसका आंसर है C. इनर लिमिटिंग layer.